The serious impact of cyber attacks we're talking about right now in healthcare, it goes far beyond privacy, that hacking creating obstacles for doctors and nurses who are doing their best to perform their responsibilities. So joining us live now is our Chief Health Editor, Dr. Partha Nandi. And Doc, we do want to mention you're not associated with Ascension, but you do work in a hospital. You can relate to this. Can you speak to how cyber attacks impact patient care, from ER visits to even scheduled surgeries?
First of all, it's super scary. This is going to affect, like you said, patient care. It's like the worst nightmare we have in our modern world. The unfortunate reality is that a cyber attack can seriously disrupt our patient care in several ways. It would be detrimental if we as physicians didn't have access to patients' previous records. In the emergency room, doctors need quick access to patient information to treat people quickly. Delays could slow down diagnosis and treatment and possibly place critically ill patients at risk. Now, for planned surgeries, many healthcare facilities rely on complex scheduling systems. These are often connected to a network along with specific medical equipment, and a breach in security could lead to canceled or even delayed surgeries. Whereas still, if patient records are compromised, then surgical teams, they may not have essential patient information like medical history and health conditions. So this could increase the risk of complications, which we don't want, right? During procedures, a cyber attack could also disrupt monitoring systems that tracks patients' vital signs. So really timely interventions could be affected, leading to potentially precarious gaps in monitoring and care. And also, many docs use electronic prescriptions, including myself, and that could be impacted. Delays in medication administration or even errors in dosage due to manual processes could happen, or patients may find difficulties in getting necessary medications. So it really could affect it in many ways.
So Doc, what are doctors and nurses doing to provide better care, if possible, and how difficult is it to do your job without computer access? We're all living by this, and we're hearing about what happened in this case.
We're here for the patient, right? Okay. So we'll do whatever it takes. But the challenges can really vary depending on the extent of the cyber attack and how much the healthcare facility relies on the digital systems. We as doctors and even nurses and other healthcare providers must rely on our training and experience as well as manual processes that we did before. We may need to keep those paper-based records to document patient information, medical histories, and treatment plans, which can be super time-consuming in this day and age. However, some healthcare facilities may also have alternate backup systems in place, and this could help us access essential information and keep things running smoothly. It's just, to me also, I'd like to say it's unfortunate that people take advantage of patient care to make money if there's a ransom there, et cetera. It's just unfortunate that they would compromise patient lives. So this is very disappointing.
I hope that is heard. Appreciate that sentiment, Doc, and your time. Thank you. And if you have a health question for the good doctor, you can email him, Dr. Nandi at askdrnandi.com, or send it to us on Facebook or Twitter. We'll get it right to him.